I'm Monica Robbins with your top 3 health headlines. Artificial intelligence is changing the way many Americans approach their health, but a new survey sheds some light on how it's being used. Researchers at The Ohio State University Wexner Medical Center find public support for AI in healthcare has dropped from 52% in 2024 to just 42% this year. However, half of adults surveyed say they've used AI to make important health decisions without ever consulting a doctor.
The healthcare teams are not using it blindly, and patients need to understand that they should also not be using it blindly, but in conjunction with their healthcare team to be able to reach what the best options are for them.
Experts say the smarter approach is to use AI as a starting point, not a final answer. Understanding symptoms, explaining test results, and preparing questions before your next appointment are all areas where AI can help, as long as your provider makes the final call. If you've been sneezing, sniffling, or feeling run down this spring, you may be wondering if it's a cold, the flu, or your allergies. A Cleveland Clinic allergist says one key clue is timing. If your symptoms show up around the same time every year, allergies are likely to blame. But an itchy throat, eyes, or ears point to more allergies, while fever, body aches, and chills suggest a virus. Allergy symptoms also tend to linger for weeks, while a cold or flu typically resolves much sooner. If you love hitting the snooze button, you may want to reconsider. Cleveland Clinic sleep specialists say chronic snoozing can interrupt REM sleep. That's the stage critical for brain health, memory, and processing emotions, and usually that happens early morning hours. Now, experts say set your alarm for the time you actually need to get up and put it across the room to avoid hitting the snooze. And if you're still having trouble getting up, you may not be getting enough sleep, or you may have an underlying condition like sleep apnea or insomnia. Talk to your provider about options that may help. I'm Monica Robbins, and that's your Daily Dose.